Hi, my name is Nick Bancroft, representing physical therapy.
And my name is Kayla Heggie, representing occupational therapy.
We'd like to thank you for watching this video. Today we're going to discuss the protocol for Dr. Molly's total knee, hip, and unicompartmental knee surgeries. Now we're going to talk about doing the stairs. This is Max following his total knee operation. What we're going to do now is we're going to walk over to the stairs. And before you leave the hospital, Dr. Molly requires all of his patients to complete the stairs. Whether you have them or not, we're going to do them, just so that we know that you are able to do them functionally in the world. So Max, let's go ahead and go to the stairs. We'll walk right up to the stairs. Go face the walker towards the steps. Good. When we do the stairs, we like to typically use a cane instead of the walker. And in your book, it shows using a walker, but using a cane is a little more functional, a little less cumbersome than using the walker. So the old saying of going up the stairs is up with the good, down with the bad. So what Max is going to do first is place the cane up on the step, up with his good leg, which is his non-surgical leg, followed up by his bad leg or surgical leg. Good. Once Max is to the top, he's going to turn, switch hands, place the cane down first, and down with the bad leg first. Very good, Max.
When stepping in and out of the tub or the walk-in shower, the method is to step in with your good leg first and then your operated leg. When you're stepping out of the tub, you want to step out with your operated leg first and then your good leg. We'll have Max demonstrate this for us. So you'll back up to the tub, and you can use your walker as support as long as you're putting support down and not pulling. And then he will step in sideways with his good leg first, and then his operated leg. Stepping out is just the opposite. And as you can see, he used the grab bar as support, which is great if you do have them at home. One thing we wanted to mention is to not use your shower curtain rod or anything unstable to support your body weight. So we'll have Max step out, and like I said, you want to step out with the operated leg first, and then your good leg. For the first 3 weeks when you're at home, you'll want to spend 80 to 90% of every waking hour laying flat in bed. When you're not laying flat, you'll want to be up for 5 to 10 minutes every hour. You can be up a little bit longer for meals and showers, about 20 to 25 minutes. But when you are laying flat in bed, you'll want to make sure you have the proper positioning.
For the positioning, as you see here with Max, his legs are elevated above his heart on pillows, with the pillows down around the ankle and calf area. Extremely important that we don't have any pillows underneath the crease of the knee. What this does is causes some flexion in the knee, and the hardest range of motion to gain is that total knee extension. So as you see here, Max's knee is supported, or ankle is supported by the pillows low enough so that we create a suspension bridge where his knee can hang and get that straightened range of motion. So to further clarify on our total knee extension and knee flexion, as you see here, Max's knee is what we call total knee extension, or the leg is straight. The knee is not bent, pillows are not underneath the knee here, causing any knee flexion or knee bend, okay? What's going to happen as you're sleeping through the night or resting through the day is that these pillows are going to slide. Let's go ahead and lift your legs up towards the knee. This is what we do not want. This causes what we would call knee flexion, or the bend of the knee. If we stay most of our day, 90% of the day, with our legs elevated in this position, it's going to be very difficult to get that full extension or straightening of the leg. So make sure you are very conscientious about keeping the pillows down at your ankle and calf to get that knee straightened out. Ideally, we would prefer you to be lying on your back on a flat surface on the couch or the bed. But if you do choose to use a recliner, we would like to note a few points of getting your knee straight and elevated. So as you see here, Max is reclined back in a recliner with his knee up on the leg rest, but his knee is not fully extended or straightened. So it is very important to make sure that we apply enough pillows underneath the legs at the calf and ankle area to create a suspension bridge. So actually, if you see here, still we might need a few more pillows to elevate a little bit higher. So now we have created a suspension bridge to where nothing is impeding or stopping that knee from fully straightening out. We'd also like to note that we'd like to get your leg elevated as high as possible in this chair. The next exercise we're going to describe is the heel slides. It's very important to complete these exercises in order to get the bend back in the knee, or the knee flexion. So as you see here, the goal is to pull your foot back as far as you can using a paper towel underneath your foot to help give it a slicker surface so that it can slide easier. So as you see here, you're going to slide your foot back as far as you can, get a good deep stretch, hold for a couple seconds, 3 to 5 seconds is what it mentions in your book, then relax and straighten it back out. Good. And each time trying to go a little bit further and get a good hold. Very good. And straighten back out again. In your book, it describes to complete 30 of these 3 times a day, but we have found that you're going to be up every hour for 5 to 10 minutes, so if you do 10 to 15 of these each hour, that seems to work out really well. For the first 3 weeks, there are 2 exercises mentioned in your book that we would like you to begin. The first one being ankle pumps. So simply all Max is going to do is pull his foot back as far as he can, keep trying to keep his knee straight, and then forward again, just like you're pushing a gas pedal. So back and forth again. In the book, it describes completing these, doing 30 of them 3 times a day. We have been telling patients to complete 10 every hour, because you're going to be up approximately every hour, 5 to 10 minutes every hour once you lay back in bed, to go ahead and complete 10 or 15 of these. You really can't overdo these. So as long as you make sure you're doing these exercises. Another exercise we are going to talk about today is listed in your book under phase 2, is called the quad sets. We are emphasizing this to try to get that knee to straighten all the way out. So what this exercise consists of is tightening this quad muscle above the knee by pushing your knee down into the bed. Hold for a few seconds, good Max, and then relax. In your book it says to hold for 10 seconds, anywhere between 5 and 10 seconds to get you a good, nice quad contraction, this muscle tightening enough to try to straighten out that knee. So go ahead and tighten again, pushing down, good. Hold, 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 hold. Excellent, relax. Again, doing 30 of these 3 times a day is mentioned in the book, but if you want to do 10 or 15 of these every hour, that's not going to hurt you. That's going to be great for your knee to get that knee fully extended. Good, Max. Hold, 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 hold. Relax. Excellent.
2 items that you'll go home with to help prevent blood clots and to improve circulation are white compression stockings, or TED hose, and calf pumps. For the compression stockings, you'll have 1 on each leg, and you'll want to wear them if you had a hip surgery during the day. You can remove them at night, and if you had a knee surgery, you'll want to wear them all the time. To care for the TED hose, you'll want to hand wash them and hang them up to dry, not use the washer and dryer for those. For the calf pumps, you'll want to wear them for 18 out of the 24 hours of the day. They wrap around both calves, and your nurse will help you put them on before you're discharged. They're battery operated, so you'll want to charge them as much as possible. The majority of patients will be discharged with an Aquacel dressing over their incision. These dressings are waterproof, so you can shower with them. You just want to avoid using any harsh soaps or chemicals around the area. So you'll want to use soaps such as Dove, Ivory, or baby soap. These Aquacel dressings will come off after 7 days, after which the incision can be opened to air.
The next thing we're going to discuss is getting in and out of a car. So the easiest way we have found to do this is to back up to the vehicle on the passenger side, reach back to hold on to the vehicle, sit, and now what you're going to have to do is help swivel your legs into the car. So we'll get your good leg in first, and then now your surgical leg, you may have to help a little bit to get into the vehicle before leaving. Getting out of the vehicle will assist your surgical leg out first. Pivot around, and now use the vehicle to help yourself to stand up, and then you're out to the walker.
We wanted to thank you for watching our video. We hope it was helpful for you. If you have any questions, there's a lot of great information in your book. There's also a hotline number that you can call 24 hours a day, or you can call the orthopedic office. Thank you.
Thanks.